Hello, I'm Najali Doku and welcome to JNI. But before we do anything else, the Director General of the Ghana Health Service is addressing the media on the novel coronavirus.
Our response has been first in terms of coordination. We've met all our key actors, the teaching hospitals, the regional directors, immigration, port health, etc. All those who are likely to be part of this have all been met, and we've had deliberations. We've met more than 3 times as NTCC and other fora we have met to review that. The current situation is that we have nearly 60,000 cases and about 1,400 deaths. Most of them as you are aware, in the epicenter of the issue. But let me explain the 59,000. The 59,000 doesn't mean that they are on a death row. A lot of them have recovered. And the kind of what we call case fatality rate we have, that is the number that's expected to die out of any number, is that for every 100 people who pick up the disease, roughly about 2 or 3 are the ones who succumb to the situation. So what it means is that if we have a cumulative figure of 59,000, it doesn't mean that there are a large number of people like that Accra Sports Stadium waiting to die. A lot of them have recovered and gone back to their regular life. Our response has been, I'm not going to go into detail, but Dr. Sarko will give a longer briefing. Primarily to prevent importation.
Preparedness. Then going forward, you will subject this to discussion, then also input your comments and suggestions to our national preparedness. The outline will go by brief introduction, a bit of background, what we are doing as a country with regards to our preparedness, what actions have been done so far. There are still a lot that have been planned, started, and still ongoing. So we have not concluded and have not finished all the actions. There are still a lot more being done. What are the various expectations and then the issues to do going forward? Next slide. Early in the year, the World Health Organization received information from the People's Republic of China, their country office, WHO, reporting of confirmed new virus, which is presenting mostly as pneumonia of unknown origin. You get a pneumonia, do quite a lot of tests, and then as much as possible, getting the confirmed germ, which was causing pneumonia. The pneumonia was a bit of a problem. And it went on for some time until later in the year that we clearly identified the causative germ, because of which we met here to discuss for this meeting. The ongoing viral epidemic has affected mainland China alongside with isolated cases in about 28 countries. The outbreak was initially restricted to some local animal market in Wuhan City, Hubei province of the People's Republic of China. Initially, people whose activity were taking them closer to the market, closer to specific animals, were having the infection and then developing the severe complications, some of them, a few of them, dying out of it. Later, it became clear that spread from one person to another, which we call sustained human-to-human transmission, was established. And that was early in January this year. The disease is characterized by fever, cough, difficulty in breathing, and in the last stages, complications include pneumonia, kidney involvement, and then whilst you have severe pneumonia, breathing becomes difficult, kidney is affected, and then some of them succumb to the virus and lose their life. As of this morning, and the area west affected by now is in the evening, so their data as before you wake up, we use the most recent update from them, which is, as DG rightly mentioned, more than 60,000 confirmed cases, including nearly 1,400 deaths. The case fatality, which is the proportion of people who die as a result of this, is about 2%, ranging 2.4, 2.5%. In Ghana, we have had 15 suspected cases, and all of these have been tested. We've sent samples from them to the Gucci Memorial Institute of Medical Research, which is our national reference laboratory, and all these have tested negative for the virus. I think 3 or 4 of them, we could get a clear diagnosis, which were seasonal influenza. Next slide. I will talk briefly about the name. The name that you used to mention, you realize that when you said the COVID-19, which is a very recent name for this virus, you are dealing with a virus that you've lived with just for over 2 months. You are dealing with a virus that received its name just a day ago. No one of us can now say that they know all the behavior and characteristics of this virus. So as much as possible, based on the information that the family of these viruses do exhibit, that we project, but then being born into a family, your behavior may be a bit different from your mother, your parents, your grandparents, so we still have to continue studying this virus, and it's important we take note of that. Commonly, in common parlance, the virus initially being from the coronavirus family was named as coronavirus. Because it's a new virus that has expressed some new characteristics that has never been exhibited, then the new coronavirus came up. Then, because it was first found in Wuhan city, Hubei province, Wuhan virus is also, these are all provisional names. So later, WHO came out that you have to start getting more structured. And then the name 2019 novel coronavirus emerged, which was the name from the World Health Organization. We all have been using this until recently, 2 days ago, yesterday, that International Committee on Taxonomy for Viruses came out clearly. This virus is similar to SARS and the SARS-2. So that is the international scientific name for this virus. And then WHO on the same day indicated that this should be called coronavirus disease 2019, COVID-19. So now either you use SARS-2 or COVID-19. The first names, if you are given a name before christening, when the christening, the adoring is done, then you have your full name. So the new name now, 2 of them, SARS-2, SARS-CoV-2, the SARS coronavirus 2, or the COVID-19. Next slide. The incubation period of the virus is about 2 to 14 days. This is what the CDC indicates. The WHO indicates that it's about 2 to 10 days. Ghana has adopted the 2 to 14. Should it become necessary to watch some people in the period that you have to observe them with regards to quarantine facilities and so forth? We have to go by the maximum incubation period, and we think that it will be safer to use the 14 days. It may be contagious during this period before signs and symptoms do start. And then even people having recovered, I think up to about a week or so, can still manifest the possibility for transmission. Symptoms and signs mentioned earlier, you go through again in a few slides. We have fever, cough, difficulty in breathing. These are the major cardinal signs. Other acute respiratory signs and symptoms may manifest. Runny nose, sore throat may also be some of the signs and symptoms. The death rate you mentioned is about 2%, roughly around that. And we believe that over the period, this will change and may come down. For every outbreak, initially, the case management is not as good as it is where they are having the cases. And as and more people get the infection, a lot more attention goes into case management, people reporting early, then the case fatality comes down. So I believe that this may come down over a period. As we speak now, there has not been any effective vaccine or medication being antiviral agent to manage. And that is the relevance for us to take the various preventive measures, which have later you outline some of them. You need to take them serious. And you continue to count on you to provide the needed education to the good people of Ghana so that they will appreciate how to, as be simple, hygienic, so we would use simple measures that have been found to be effective to prevent and protect against the virus. The 30th of January this year, the World Health Organization declared this event public health emergency of international concern. Coronaviruses, including SARS, Middle East respiratory coronavirus, MERS-CoV, have demonstrated sustained human-to-human transmission, and that is why when you are in a family, you can at least predict some of the characteristics, how you will be from the family. And I think this is the 7th that has emerged from this series of virus within the coronavirus infecting humans. The 2019 gene that has just come up, the COVID, is about 75 to 80% identical to SARS-CoV. And there are some group of viruses in bats, and this is about 85% similar to such viruses. But then the virus, this very one has not been found in the bats, and the bats has not been implicated as a means for transmission. But then you need to watch them very closely because the virus keeps changing its nature. And this is a new virus. You don't know much about its characteristics. So you have to continue to study all the potential risks that they will pose to us as a human group. All the coronaviruses have demonstrated the potential to spread from one person to the other. And then transmission is mainly through close contact, through coughing, sneezing, releasing droplets, people getting it directly, and then when the areas surfaces, table surfaces, and other surfaces as door handles are affected, if somebody gets the contamination from there, you can also spread and infect yourself. If you rub your eyes, nostrils, and eat with hands contaminated without adequately washing hands. Next slide. These are signs and symptoms, mostly with the respiratory signs and symptoms, which include sneezing, runny nose, sore throat, cough, which mostly dry cough, and then shortness of breath. The first case that was found in the US was the virus strand was found in the stool, giving the impression that potentially there may be hand to mouth through the feces, orophycal transmission. But this has not been demonstrated yet. Let's not jump the gun, but then continue to watch the virus as we are knowing more about how it will behave. In the later stage, severe pneumonia, kidney problems, and then when we are having such complications, death is the end result. Next slide. Diagnosis is mostly by real-time polymerase chain reaction, which is a type of test which they use genetic materials from to get this done. There is no immediate point of care test. The good thing is that here in Ghana, the Gucci Memorial Institute Medical Research has the capacity to do same test here as they would do anywhere in this world. And the 15 cases suspected, they have subjected these samples to this test, and all of them are negative. KCCR, Kumasi Center for Collaborative Research, has also come out strongly with the capacity to conduct the test. We are to provide them the enabling environment and provide them support so that they will take up the middle and part and then the northern belt of the country. There is no point of care test for now. So every suspected case, it has to be sent to Noguchi. Later, KCCR will join to get a test done. Spread from aerosol, you mentioned that, and if you are in close contact up to about 2 meters, then the risk is high. Other areas as door handles and then railings are also potential sources for infection. And then the virus can suspend in the air for a short period. When they drop outside the human body and other living organisms, they live not up to a day. This is good for prevention and protection. So when you practice adequate hand washing, use hand drops, and then other measures of hygiene and sanitation, I think you would win this war against the virus. And then he mentioned the virus being found in a stool, but the oral-fecal transmission has not been established. Next slide. Next slide. Prevention measures, you need to avoid exposure as much as possible. And this is very key. Avoiding exposure means that one should not cough at others. Don't allow somebody to cough at you. And then sneezing etiquette is very important. Hand washing, and then as much as possible, should there be a suspected case, any contact within 2-meter range is a high risk. Improved hygiene and sanitation, hand washing, very important, using soap and water, and then use of alcohol-based hand rubs. And the alcohol concentration in this should be 60% at least. At this stage, not only anybody sprinkling some alcohol in some fluid and saying that it's a hand sanitizer, it will not help. And then respiratory hygiene, cough and sneezing etiquette is very important. Quarantine measures, very key. What we have agreed and decided as a country, for now, the most at-risk area is the Hubei province, the Wuhan city. Anybody coming from this area into the country, we have made and put in mechanisms to quarantine this person for a period of up to for not less than 14 days. Quarantine means that somebody exposed, suspected to expose, has not started with signs and symptoms. Those are the people that we do quarantine. Let's take the difference between isolation, where somebody has signs and symptoms, which could be the infection. At that time, when you take you aside, it's not quarantine. That one is isolation. The outdoor restriction mainly being practiced in China, and the affected area has been locked down. Nobody goes, people are not allowed to go in easily unless specially arranged. And then people are also not allowed to come out unless specially arranged. Should there be any movement from this area to any other area, there should be a permission from the Chinese government. And then even if you are going by air, you don't go by transit flights. It should be a chartered flight which has to be arranged if you land somewhere else, just for refueling and for emergency situations. And then you move and go to the designated point where arrangements might have been done for quarantine, and then you do best and do this movement without undue contamination of other people and then the environment in general. Research is ongoing for vaccines and also for medication, but then we are not there yet, so you have to use these basic principles to prevent and protect against the infection. Next slide. Management, no effective medication as at now, nor is there a vaccine. And treatment, should somebody have the infection or suspected to be infected, what we do at the health sector, the various signs and symptoms that the person exhibits and manifests, these are things that we give medications and other treatments to support what the difficulty the person is going through. Flu medications help to minimize the cough intensity, the sneezing intensity, and then also give some relief and comfort to the person. Drinking a lot of fluid has been found to be effective. Resting is very effective. Oxygen therapy, IV fluids, and then breathing and other respiratory support. Next slide. Activities done, some of them are ongoing. There are structures, whatever I will say, from the national level to the regions, the districts, and then into the facility. There are structures in the country for public health emergency management coordination. All these structures at all levels have been activated. Earlier, as soon as we had this on the same day, the Honorable Minister provided a release giving general information to the general public as to how he have to prevent and protect against this. The Director General of Ghana Health Service sent alerts to all the health facilities within the country, the regions, teaching hospital inclusive, the regional hospitals, district hospitals, and they were requested and charged and directed to send such information down to other facilities that they superintend. So these mechanisms has been activated for the management and prevention measures within the country. And then the National Technical Coordinating Committee, which is intersectorial, multidisciplinary, working with the partners, and deliberating on this, coming out with key plan for the country. This committee has met about, I think, 3 times. And they give information to the respective ministers so that should there be interministerial coordinating meeting, then this will be the source of information, and the respective ministers will provide the needed information to the high level to the #1 of the country and the presidency of this country. We are working in specific thematic areas with regards to coordination. I mentioned the public health emergency management at the national, the regions, the districts, and then the various facilities. At the national level, the Director General and the World Health Organization country rep co-chair. At the regions, the regional minister or his rep chairs this. At the districts, the honorables of these district chief executives, municipal and metro chief executives chair such structures. The surveillance apparatus within the country, regular surveillance, routine surveillance, the surveillance at point of entry, all these have been stepped up and heightened. The laboratory testing, you mentioned the capacity for testing at Noguchi, KCC are adding on. The points of entry, surveillance at all the various points of entry, particularly the 14 designated, especially the heavy traffic area at KIA, at Elubo, Aflao, and all these heavy traffic areas. We use other thermal scanner, non-touch thermometers, so that whilst people are passing, the thermal scanner, if you're not careful, you may not realize that you are being screened. People are watching. If your temperature is normal, there is a label on you which they know this temperature is normal. As soon as the temperature reaches the 38 degrees C, this color marked on you will change to red. Immediately, somebody will tap you, send you to the side, ask more questions, so that we would find out where you are coming from the last few days, where you have been, whether you've been in contact with people affected, where you are going to in the country. Should there be the need to take samples based on our observations and interrogation, sample will be taken. This person will be kept aside in a place of cordon and isolation at that time, and then samples sent to Noguchi, not until the report is out. This person will not be allowed to move out from where he's been restricted. So that is the screening at the point of entry, using the thermal scanners and also the health declaration forms. Case management, we have identified some facilities which the next slides will tell us. And these facilities at Ridge, at Tema, for now are ready to handle any confirmed case within the country. And as much as possible, all the teaching hospitals, all the regional hospitals, and then other big hospitals in the country have the capacity to handle case. We've inspected such facilities, and some of them are in preparation, but Tema and Ridge are ready, and then others are also beefing up their capacity. Risk communication, social, we've met the various key partners and stakeholders. The Minister of Health, I'm aware, has met the key stakeholders together with the Director General, the various CEOs of the teaching hospitals, the regional directors, and then the private providers, their leadership, Dr. Morrison, the CHAG. So all those people whose activity are very relevant for this, the management of this outbreak, have been engaged. And then the engagement is ongoing. We continue to dialogue and discuss with them to step up all that we would observe and the subsequent things that we need to do. The private sector, National Ambulance Service, Noguchi, KCCR, and all these groups have been met. The Kutuka International Airport, Tema, and other seaports, other points of entry leadership. As we speak now, there's training and orientation going on for all the port health staff here in Accra, and it's up to tomorrow. And so this capacity, we will not say that the capacity is optimal for now. We are doing best. At the moment, whatever you do and where you need to step up, we move and step up appropriately. I'm aware the Honorable Minister of Health has engaged the ambassador for China to Ghana, and a lot of discussions, important discussions has been done. One, to agree and discuss with modalities to map out the various Chinese communities within the country and see how we interact with them, minimize and restrict movement to the country from China solely to essential trips, and then also vice versa. So movement for now to and from the affected area should be informed by the essence of what is being done. We've planned a number of stakeholders engagement. You've mentioned them. Beyond the regular national structures that you've met, meeting with World Health Organization, CDC, UNICEF, and other development partners, all these are very important, and you've done this. The national objectives for prevention and containment is very key. Just to sum up and saying that the leadership of this ministry, Ghana Health Service, and then the health sector are doing best to reduce importation of this virus into the country. We are doing this working with the various points of entry. Unlikely event of its happening, of this occurrence, we have to do best to minimize the spread. And early detection is very key. Containment measures immediately to address this issue is very important. Case management, contact management, social mobilization, risk communication, all these are very important. And then, of course, very importantly, awareness to the general public. Surveillance, we have case definition. That is what we use to find the case. You mentioned the signs and symptoms. Anybody with the signs and symptoms, because you have not recorded a first case, there's the need to link up to the affected area, affected people, and then, so that is the case definition for suspected. When we suspect somebody and do the lab test and it's positive, you get the virus isolated, then it's a confirmed case. We have a suspected case, and this case has direct link with confirmed case or a suspected case, high ranking, then it becomes a probable case. So that's the case definitions that we are doing, looking for possible cases for the country. Next slide. The surveillance as point of entry, we've mentioned and discussed it at length, using thermal scanners, health declaration form, engagement with the staff. Every day at KIA, Kutuka International Airport, about 2,500 passengers are screened, and for now, I think a few of them, up to about 4 or so, we picked them as suspected, and then all of them have been negative. Currently, we are using the health declaration form. Initially, we were using them mostly for people coming from highly affected area, but now everybody crossing our border at the heavy traffic areas, use the declaration form for them. And you send circular to the airlines to win their support so that they partner and work with us adequately so that we all fight this together. And you mentioned the sensitization and training of the port health staff, and whatever you observe at the port health, we are beefing up our effort. Case management, we have designated treatment centers. We mentioned them earlier, and the Ridge Hospital, and also at the Tema Hospital. 5 facilities designated for now. The regional hospital here in Accra at Ridge, Police Hospital, Tema, Lekma, and Kolebu. These are all the same clustered at the south because here you have the highest risk. But then also mentioned earlier, the regional hospitals, the teaching hospitals all have the capacity and potential to handle cases. We've developed protocols, guidelines, algorithms to handle the cases and directly giving directions and as to how, one, to pick the case, what to do to a suspected case, what sample to take, where to take it to. If it happens to be positive, what do we need to do? Arrangement of the National Ambulance Service to take this case to designated treatment center without undue contamination of the environment. So these are the protocols. We've done quite a number of technical support visits, directly observing what the various staff are telling us, and then see the need for them to do more when appropriate. So supervision, monitoring, and technical support visits is very key. Training of rapid response team at the various areas that you manage the case is very key. Contact tracers is very key. Should you have one confirmed case, going back, you will have to trace about 250 to 300 contacts. And we have put in place staff to handle this. Just to digress a bit, the case of Ebola that was confirmed in Nigeria. This flight landed at Accra, KIA. About 20 people disembarked, but then we picked and traced these people to the maximum incubation period of 21 days. That was that time. And even now, even systems are more sharpened and more enhanced. So we have mechanisms for contact tracing. Infection prevention and control is very key for the staff that handle the case. And the use of personal protective clothing is very crucial. And initially, there were some limited amount with the big facilities. Just last week, up to about 5,000 have been taking delivery of about 5,000. The ministry taking delivery of, I think, NDG, about 10,000 more. So we are procuring more. Immediate action, then giving some scenarios and models. If you have this, what do you do immediately? So that is the situation for the preparedness. Risk communication, social mobilization. We've done quite a number of press releases. I think the 4th one came last night. And then updated releases. We've reviewed the risk communication plan. Key messages have been developed. We have some jingles which are now in English language being translated to the common local dialects and languages. And I think at that time when they are ready, we will count on your support to try best and help the country to inform the people as appropriate, using your social responsibility as good people and as brothers and sisters in the media. The briefing to the Honorable Minister has briefed the entire House of Parliament, and this afternoon we have arranged to brief the Parliamentary Select Committee on Health and other key stakeholders. The press briefing for the Minister, I think you've mentioned that, and then general population education, beyond the mass media, which we partner with you to get these things done. It's important to use one-on-one contacts, small group discussion, small group information to address the needed behavioral changes that we need to come up to. So beyond this, there are other smaller group discussions and some information sharing that have been outlined. We have various leaflets. Next slide. Various leaflets. Next slide. Next, yes, let's continue. Yes, these are some of the releases that you've sent, and then next, continue. We have developed such material, not that we are developing. We've developed and printed out, shared some of them, and then we keep sending them out. Next one, let's add more. So that these are the things, let's go back once again. to let the general population have enough information to our staff, pull-ups at the various specific areas at the various points of entry. These are things that have been done. We need to do more, and we shall be providing more information for people to know what to do subsequently. Next slide. And broadcast messages, you mentioned the various screen at the KIA, the information to give to travelers that are coming in when they are within the country, what should they do? Media engagement is very key. Thank you so much. Over the period since this started, you have never rested, and we appreciate that. And not until it's over, we are always prepared to partner with you. Most often, some of you work to our office, the office of the minister, the director general, to my office, and using your own resources to support this. This is very encouraging and positive. Let's sustain it so that together, all of us are fighting this and making sure that if we can push it away completely, you do that. Should it happen, you pick it early, don't allow it to spread unduly, and then contain it at source. Next slide. Further actions, there are a lot of things that we have put in place. We started most of them, but they are business in progress. And funding mechanisms, whatever we have received now, I will say it's just a drop in the ocean. We need more resources. We need to talk to the partners for them to look at areas that they will support technically, financially, and then in kind. So these are the areas that we are doing with regards to the support that you require. Whatever we mobilize doesn't end and get locked up at the national level. We plan for the national, the regional activities, the district activities, the facility activities, and community activities. So these are the various plans that we have. Mobilization, the various points of entry activities is very key. We do appreciate the comments that will come. At any time when we need to set up more and strengthen mechanisms, we hear and listen in good ears, and then strengthen supervision so that the people out there that need to deliver, they will deliver as appropriate. Sensitization of relevant agencies is very key, and I mentioned the various partners and key stakeholders that we have engaged. Next slide. Surveillance at all levels, national, regions, districts, points of entry. Surveillance is very key, and as much as possible, as you are preventing and protecting against. Should it come, how do you pick it early and deal with it? And you are using the needed surveillance apparatus to address the issues. We started train the surveillance staff, sharpening their skills, giving them the case definition, and then how to use the case definition to continue looking for cases. Should he have confirmed case, how do we trace back immediately to pick the contacts and manage all the contacts? Those that we need to hold in quarantine, you prepared the facility for that. Conduct clinician sensitization so that staff would be in position to help others without unduly placing themselves into undue risk. So staff training is very important. Point of entry training, sensitization, and enhancing the various surveillance structures at the various points of entry is very key. And this has started, and you keep improving on this. You printed out leaflets, flyers, pull-ups, and other information, developed messages at the bigger traffic area to facilitate information sharing. Training of point of entry staff, I mentioned, started and we even continue today. Then engaging key stakeholders at KIA, TEMA, and other points of entry, including the Grand Crossing. And we have done working with the immigration, working with the Ghana Airport Company Limited, working with the Customs Access Preventive Services. Case management is very important. We have national case management team. These are people, some of them were part of the team that went to support Liberia and Sierra Leone at the time of Ebola. Ghana trained and supported 42 people as support from Ghana to go to Liberia and Sierra Leone to support them there. 42 of them, none of them got infected, and all of them came back safe. So these are the caliber of staff that we do have. All of them, they have been reoriented and given the needed support for them to adapt and use such skills to help us. We train regional teams, staff at the various districts. District team has started, but then the capacity there, we need to do more. And then we developed and printed out and disseminated case management guidelines, standard operative procedures, and then algorithms, how to put on PPE and put it off. Donning and doffing is very important. And then the various infection prevention and control measures the training has started and ongoing. Specimen collection, how do you pick the sample, package it well, you call it triple packaging, to put it in a well-secured manner such that you wouldn't let it spill over and contaminate and leak to infect the environment, and then also put the staff that are handling it at undue risk. And then procurement and distribution of personal protective clothing is very important, and all these things are ongoing. Risk communication, we've done a lot, flyers, pull-ups, communication, advocacy materials, media briefing, orientation of the teams in the regions, districts, facilities, and community level. Our leadership at our religious leaders, the various traditional leaders, the various administrative leaders at the metro, municipal, then the districts. These are all very key people that we are working with. The hoteliers, very key. When people come from specific areas, they may live in hotels. You need to partner with them and then let them help as much as possible. Working with the various schools are very important. Organizing radio and TV discussions and shows, these are things that you count on you and request that you support the country to get these things done. Announcement in churches, in schools, mosques, developing dictums to let the church leaders, the mosque, the other religious leaders, in very simple manner with which they can use when they mount the pulpit and other areas where they are disseminating their messages. Also think and talk about the virus as well. I think this is the last slide. Thank you for your attention. There are issues for contention which we may discuss. We are aware, the DG, the minister, and it comes to us that there are some Ghanaians somewhere in China, they are calling to be brought back home. The discussion is ongoing. The government is very sensitive to their request. The Minister of Health, the DG are all very sensitive to their request. And there are a lot of scenarios that are being discussed. Clearly, the structures and systems in China to manage this is very key. So they are good at managing such viruses. They've done it before. SARS, MERS-CoV, they handled it in good hands, and as much as possible, they have the expertise, the resources are there. At any time, we are monitoring very closely. The Honorable Minister of Health, the Minister for Foreign Affairs is in close contact with the ambassador in China, Ghana ambassador for China, and they are doing best to ensure that our children and other citizenry out there in Hubei province, they don't suffer unduly. And as much as possible, as we have listened and heard their plight, there is the need for enough dialogue between various sectors to decide the best way going forward. And as much as possible, parents that have their children out there should just work with the leadership and ensure that whatever decision should be the best decision in the best interest of the children and also the best interest of the people of Ghana. Thank you very much, and this is the end of this presentation. Thank you.
Thank you very much.
Thank you very much. I'm sure we've listened closely at the responses, at the presentation, and our preparation. Maybe to just go over a few things. In terms of the funding, you are working in scenarios. So if you want to work on the long haul, we need a lot of money. But you have to work in stages. Let's say in the next 3 months, the issues are over. You don't, right? So what we have received is what we are using in the initial phases, and as this goes on, more resources, I'm sure, will be released. As the Sarkodie said, we are giving very technical position in terms of disease outbreak management. We don't, I'm sure, you don't, you try to contain whatever it is where we are, as long as it is possible. So far, like I said, I'm sure Ghanaians living outside is a concern for all of us. And if you have seen the new press release from the minister last night, so far no Ghanaian student has contracted the virus. We know that there's only one Cameroonian girl who has actually recovered. In terms of management of those cases, like Sako said, we don't have the experience. It's a new virus, and so we believe that China also has probably the best system to be able to manage it in the unfortunate event that such a thing happens. But like you said, we are also still keeping a watch to see the situation as it goes on. But currently, as you saw in the press release, the caution, as WHO has said, that evacuation is not advisable. Many countries in the African continent has also ruled that out. And but we are also still keeping a watch, just like we had other conditions like Ebola, etc. You don't move it. Let's take, for example, if you have, if let's say there are no walls, if there are no walls in this country or in this world, what it means that you try and manage things where they are as much as possible. Like I said, the most important thing, we are trying to contain the situation, and so far, the information we have is that the embassy, the Chinese government is also doing quite well as far as they are concerned. So those are some of the key positions that we have as we continue to see from the press, the minister's press statement, that we'll continue observing. But if it becomes necessary, that will be, but it is not the most prudent technical advice now to do that. The floor is open, but this is just the first series of engagement. We'll be engaging chiefs and churches, other stakeholders. This afternoon we'll be meeting the Select Committee on Health to have a similar dialogue, and then also, if possible, there are plans to meet other people, parents, etc., who have concern, to be able to talk to them and see how the situation is as we continue reviewing on daily basis. So thank you very much.
Thank you very much. So the floor is open. As DG said, this is more of interactive session. If you have anything that you want to clarify, or you have something that you think can help us, please let us know. Thank you.
Okay. So, thank you very much. My name is Joshua. I work for Adom FM and Adom Online. 2 questions. I want to leave here with clarity. I know that some members of the minority in Parliament have made a specific call for evacuation. I've heard DG say that the WHO has advised that evacuation is not advisable. I want to leave here with a specific answer on whether Ghana is going to evacuate or not. That is 1. 2, is there any plan to ban travels to China from Ghana. I know that when the people come from the presentation, you quarantine. But what about people who intend to go to China in itself? Those are my two questions. Thank you.
I have a concern. Just last week on Ekusise, there's a Ghanaian who traveled from China and then went through no process. And he's in Ghana now. And that's quite scary. The next issue is what he asked about whether Tigo, the end bit was what, whether there was going to be a ban from people coming from.
Yeah, thank you. I'll take it, and if possible, if needed. I think the press briefing that was released was quite clear. That for now, that is not on the table, but we will observe every situation day by the hour, so that if there's a need to do that. You have countries that have evacuated. Let me give you an example. America probably will evacuate people and put them in a negative chamber, where a room that is negative pressure, so that if you are in that room, nothing gets out. You don't have that here. And so if you say, well, some country has done that, it depends on their system, but you need to be able to look at that. So we believe that the structures and the systems put in place there is more protective, and we will continue observing until such time that it changes. So we will not say yes or no. But if by tomorrow or the next, the condition is such that I'm sure the decision, that is not our decision, but that is more of a national decision. So I do not want to get into the politics of it now. We are only here to provide the technical advice that if in case of a disease outbreak, what do you do? And I'm sure basically we all know that when there's fire here, you don't throw the fire everywhere. You try and contain the fire there so that you can, at source, and you don't just carry it into a place where there's no fire and then you spread your challenge. Are we going to ban people? Yes, we have advised people, not ban. We have advised people that if it is not very essential, don't go. And it's not just China. I've just come from Thailand. When I came, I was also subjected to the full rigors of where are you coming from, how long have you been there, etc. And I was found not to be at risk, so I was allowed in. So that's what we are doing. We are providing information. And I believe that even the traders themselves advise themselves. I think Guta has also advised that if it is not essential, don't go. And mind you, it is not every part of China that is at risk. So there are some places where outside China that may be even more riskier, especially where maybe a place in Philippines where there have been a case. That may be more riskier than a place in China that has not had a case. So it has to be looked at in that way. And so that answers Omahene's question that if the person has come from China, doesn't mean that he has come from. So that's why if you go to the port and the declaration form, there are a lot of questions. Where are you coming from? Which countries have you visited on your way here? Where do you live? Where is your address? So like Dr. Sakure said, if in case a flight has 400 people, eventually we find somebody on the flight who was positive, we need to trace everybody who disembarked to see where they are, because they are potential contacts. So we take all that information. They ask you, whether are you coughing, do you have fever, do you have this? We take your temperature before you are allowed to leave. So basically, these are the systems. So if that person came in and he's at risk, definitely, and those 15 we have seen, it is the same process that allowed us to say, no, I think there's some risk here. Let's test you before we let you out.
My name is Fred from John. All right, so I'd like to know, you said the technical advice is for us not to evacuate our citizens from China, especially from Wuhan and the province as a whole. What if they themselves decide that they are coming on their own? Do we have the systems in place to deal with such a group coming into the country and the risks that they may pose to us? And I also want Dr. Sarkodie to explain to us what systems they have in place. You said you have a quarantine system, where they are, how many of them, what is the capacity, how many people it can take. And I'm also interested in knowing, you've received just 2.5 million of the 35 million budget that you said you need. That's why I said, okay, so tell us what is the plan to get, because this is a big project that you're undertaking, and the 2.5 is just a small fraction of that 35 million that you mentioned. What's the plan? And maybe, I don't know how this one is playing out, is my final question. I've not heard black or Africans or people of the black race contracting, apart from this Cameroonian, who also eventually recovered. Is there anything about the black race and this virus at all?
Yeah.
Good morning, Doc. My question one will be the immediate past Director General of the Ghana Health Service, who's now Presidential Advisor on Health Matters, had said that we have a robust system to be able to deal with these things. He said that to us about 2 weeks ago on TV3. What does a robust system mean? I want to know from you, now that we're being told that there's technical advice, like Fred has rehashed, not to evacuate. What does a robust system mean? That's the first one. The second part is that we were told at the advent of this scare and the reality that we have put together a special place at the Ridge Hospital, Accra Regional Hospital, where such cases would be, treated or dealt with. We went there to do an extensive story. The doctor responsible took us through what was in there. But when we heard of the 2 suspected cases at the Kolebu Teaching Hospital, they were kept there for well over 24 hours. And the nurses that we spoke to on the basis of anonymity told us that they were kept at the emergency department where there was nothing there. So if the people were susceptible to it at the time, and